Oh, I'm Joan Simon. I belong to the Santa Clara County Single Payer Healthcare Coalition.
Oh, great.
And I want to thank you very much for coming to a lot of our healthcare events. You were at Andrew Hill High School.
Oh, yeah.
Yeah, and I also want to thank you for co-authoring the bill.
Yeah,
To us, that's very important.
yeah, that's all right. Yeah.
Thank you.
I've always supported single payer. I supported Senator Leno's bill, Senator Sheila Kuehl. She had a bill, I supported her bill.
Right.
So I'm, going,
History.
my history has been very consistent on that.
My name is Antonio Mora, and I joined the group about 2 months ago.
Oh.
And my kids are grown, and they're in 30s and 40s, and they really need the health care bad. They can't be under my coverage. I myself have great coverage. I retired from Alameda County Public Works, but my kids and their families really need SB562.
Yeah.
And actually, I'm willing, everything, if we all go into it, it would be great.
Yeah, yeah.
My name is Kristen Phillips-Matson. I'm a licensed professional clinical counselor. I teach at San Jose State University. I'm on the board of the California Association of Licensed Professional Clinical Counselors. And I just want to especially thank you for your support of mental health in schools too.
Yeah,
So in addition
that's
to the
SB 191.
Yeah.
Yeah,
So thank you.
We're hopefully going to get that bill made into law. So,
Mary Hamilton, and I used to go to your pancake breakfasts.
we're going to have some of those
Yeah, I always,
coming up this summer.
I admire you and I thank you very much for supporting both those bills for the mental health and for the healthcare plan, because I have family members that have both, and
Yeah.
all of them have pre-existing conditions. I think everybody's family members has pre-existing conditions.
Yeah. No, it's true.
And I think, I'm really scared. I'm really scared. I have a granddaughter with cystic fibrosis. And
Yeah.
I'm really scared because she has very excellent coverage through the Children's, Health Initiative.
Yeah, right. Yeah, I was the founder of that.
Yeah, and they'll just rip it right away.
I was the founder of that.
Well, I
Children's
really
Healthcare
applaud
Initiative.
you. Thank you so much.
Santa Clara County. I chaired the Santa Clara Family Health Plan Board for 10 years. I was the author of the Children's Healthcare Initiative.
Sure, thank you very
Cover
much.
every kid in the county, 100%. All its children. Yeah,
Can they rip that away?
yeah, they can.
Ugh.
He's trying to cut Medi-Cal.
Yeah.
A lot of that's Medi-Cal, so. Yeah.
Hi, I'm Laura. I'm just here on my own. I guess after the introductions, I want to ask you what you think the biggest obstacle is right now to getting the bill passed.
Okay, yeah, okay. Where are you from? What do you do?
Well, I'm from Cupertino, but I went to school in LA.
Oh, okay.
Yeah.
And you joined the group here?
Yeah, I'm like in between jobs, so I have time
great.
to do something like
That's
this.
great. No, you're good. But you guys in the back there,
Yes, my name is Jose Rangel. I know Jim Beall from Santa
Yeah.
Clara County. He's a terrific helper. He's a terrific politician. He's a humanist in many regards. I want you to support 562 Senate bill.
Yeah.
And, just like you will.
yeah,
Keep up the good work, Jim. We're always
Yeah.
supporting you. Thank you, and I voted for you.
yeah, okay. I hope so.
I'm Eula Tate, and I'm here with the
Eula, nice to meet you.
Self-Help Care Center. And
Oh,
I
yeah.
come to ask if we could get the support of the healthcare bill, because we need it very badly. And I have an older son who does not have health care at all.
Really?
And if
Where do you
this
guys
goes-
live? Where's your home?
I'm in San Jose. I'm District 5.
Oh, okay. Oh.
Yes.
You go to James Lick?
No, I didn't attend.
No,
any
your
school.
son.
Yeah, I didn't attend any school in San Jose.
My stepson Greg went to James Lick.
My grandson went to James Lick.
Yeah. Jane?
I'm Nelson Uchimura. I'm
Nelson.
from San Jose, and I'm in District 15. And I remember you, years ago, I attended single-payer healthcare events in San Jose, and I remember you being there and speaking for it, so I appreciate that.
Yeah, good. Okay, thank you.
I'm Terry Gasquet, newly immigrated from another state here to
Okay.
California, and proud to be a Californian.
Yeah.
And I'm really new to politics again too. It
Yeah.
was many years ago, and definitely we need a bill like this. And I'm sorry, I really didn't know that you co-authored the bill too.
Yeah.
It's great. It looks absolutely fantastic because I want to live and thrive. Our children want to live and thrive. Our grandchildren want to live and thrive, and it's just not going to if the Republicans cut the way they want to.
Yes, yes. That's right.
My name is Rebecca Truwich. I'm one of your constituents, and we actually had the pleasure of talking a couple of years ago when you were promoting Aubrey's bill, and
Audrey.
Audrey,
Law.
I think that's awesome. I love the work you've done with mental health. I am someone who's in my 30s. I have, insurance. A lot of my other friends have insurance, and for me it's insane that because of the insurance system we have, even though they're working full-time jobs, we go to crowdfunding for cancer treatments, for medical bills, and everything to do with life. And that's crazy that I'm the bracket that the Republicans are trying to appeal to when they're like, oh, you don't want to pay for the old people and you don't want to pay for people with pre-existing conditions, and it's like, I am a full-time worker, and I can't afford, because of the astronomical prices, because there is no cap on like prescription drugs, and there is no just it's all about a profit.
Keep down the prices.
So it's insane to me.
Yeah, right. Yeah, how about you now?
Oh, now that I have my seat.
You got a seat,
Right.
What's going on?
Hey, you want me to hold it?
Yeah, so I can be on it.
Oh, yeah, I can get on there.
I've gone to your pancake breakfast, and
What's your name?
Stan Simon,
Stan.
and I really enjoyed them. And I think you're one of the good people, and there's very few politicians I can look in the face and say that to.
Well, thank you.
Okay. Now, the question that I have for you is that the last time this bill went through, and it was the Leno bill, you had 6 Democrats, corporate Democrats, who voted with the Republicans to defeat the bill.
Yeah.
Do you see that prospect happening this time?
I think there's going to be some Democrats that won't vote for it, but I think right now, given the fact that the situation has changed now, that Trump is attempting to just wipe out the current overall system of health care, I think we actually have a better chance of getting it passed now than we did before. There's in California, in the Senate, the state Senate has 27 Democrats. And I think that makes a huge difference. 27 Democrats, only 13 Republicans. And we need 2/3, and 27's 2/3. So I think there's a really good chance of getting the bill passed.
What do you do follow? Do you think the governor will sign it?
I think if we put it on the governor's desk, I think he will sign it. He'll have plenty of people telling him not to sign it, though, that's for sure. We'll have to keep the fight up all the way to the time he puts the pen ink on the paper. We're going to have to fight all the way every day to the end, to get it approved. I mean, now they're going to say it costs too much money, etc. Like you were asking about that. Why don't you shut that door so I can get a little more quiet in here? Yeah. I think that the way to look at it is to really look at it like what's it going to cost over a 10-year period versus what we're doing now, and where there's no caps on drug prices. There's 30% of the money going to administrative overhead in the insurance companies and their profit and their and all that kind of stuff, versus a Medicare-like system is what we're talking about. We're talking about, we could simply expand Medicare and expand the managed care, county managed care plan and have everybody covered.
Right.
It can be done really simply. It's not, I don't predict it'll be as expensive as a lot of people predict. A lot of people say, oh, you're going to have to set up this infrastructure. There's, you know, you're going to have massive amount of people working on the administrative. No. I think you already have an organization in our county that has 300,000 clients, which is the Medi-Cal managed care plan. You just expand that, expand Medicare, and make it work. Make sure the doctors and the healthcare system are signed up. And one of the key provisos is to pay for the reimbursement rate for the doctors, and the healthcare cost more money has to go to the healthcare rather than to the administration. So I think doctors are complaining about, well, the Medi-Cal system, for example, their reimbursement rates are so low. I think we solve that if we can get rid of the overhead cost. Okay. Just another thing, if you add up the cost of, okay, in California, if you look at California, like let's look at like what's the makeup of the California healthcare system, okay? Well, just look at these numbers. 15 million Medi-Cal. There's 15 million people on Medi-Cal. There's 40 million people, okay, in California. 15 million are Medi-Cal. So they're already on the public health care system, right? That's already there. Then you have about the covered California is another 4 million. So now we're up to 19. Then you have, let's see, I'm just trying to make sure it's not my mom or my wife. And then you have, okay, so you got the covered California, 4 million and 15 million, so that's 19 million. Then you have about 6 million on Medicare. So now we're at 25 million. So 25 million of the 40 million people in California are already on a public health care system.
Right.
So let's play games, you know. We can expand from 25 to 40 and cover everybody and get rid of the overhead. You get what I'm saying? I mean, it's not like it's an insurmountable goal, okay? I think that these people that talk about how it's going to be massive, it's going to raise your taxes and blah blah blah. I don't think so. I think we can pass a law that says nobody pays any increase in their cost. We'll just freeze everybody's cost, and then over a 5-year, we're not going to raise it. We're going to lower it.
Okay.
Okay, and then the other thing about a public healthcare system is the public healthcare system would be a preventive system, not a get sick and we'll argue with you about your healthcare system, which is what we have now, right?
Yeah.
And then they sit there and they have what they call utilization management techniques, and they hire a lot of lawyers and utilization management people. That's their version of what they call managed care, right? They're not managing your care, they're managing your not getting care. Okay, so I think getting rid of all that kind of overhead and just having the doctors and the medical professionals and the patient work on what's good for them in terms of their health care, I think is another way of saving money. And then we can have technology, telemedicine, records, availability for your records. You'd always be able to, you can get prompts from your doctors about appointments, other kinds of things you need to do, notices, more frequent checkups, and more personal visits by nurses, and you don't have to go to the doctor all the time, right? You can have a nurse come by and just kind of check you over, and nurses can say, well, okay, this guy looks like he needs to go to the doctor, or here's what I want you to do. I want you to go to the, you got that bad arm there, I want you to go to physical therapy here. That's what you call preventive medicine. You don't have to wait till you have to go to surgery or you have a heart attack or something like that. They can check you over, and you could have more frequent checkovers, less expensive emergency, higher acuity medicine. See what I mean? Longer lives. What's wrong with longer lives? Anybody disagree with that one? It's like, I don't know. I haven't had anybody raise my hand yet. My office on that one. But I think our big challenges are going to be things. You know what our big challenge is going to be? Getting people into careers for medicine. Healthcare professionals, we have a need for more people to go into health care. We have to pay them adequately. We have to, you know, why not forgive their student loans if they go into a healthcare system for the general public? You know, I think I would. Once you do that, I think some of these people that go into teach in like low-income areas or work in clinics or things like, you know, they're doing God's work. I think they ought to go into like loan forgiveness programs for their student loans, burden them for their lives, and I want them to be feeling like we care about them and their lives and respect them for their decision to serve our community, right?
Yeah,
So we got to do something to incentivize careers, you know, careers in healthcare at all different levels. And so I'm going to be working hard on that aspect. Also, workforce development issues. You know, it's good for. So in other words, single payer is good for jobs. Hires people, gives them good middle class jobs in healthcare.
Right. Well, you just
That's what we want.
You co-authored that nursing bill to keep that program in San Jose.
Oh yeah, the nursing bill to keep the San Jose State Nursing School going.
That's great.
So I'm a big San Jose State. I'm a San Jose State alum too. So's my mom, so's my dad, so's
Oh, the whole
7
family.
of my 10 brothers and sisters. We're all like San Jose State people.
Fantastic.
All of the Californians.
It's what I was thinking too, the companies that have to pay all these exorbitant health care bills, plus their employees also have to pay for the health insurance. Can they get on board to know that they would save money? Would they save money?
Yes.
Yeah, because you know what happens is small businessmen, they say they want to do their health care for their employees, okay?
Yeah, I see.
If they go to try to buy on the individual healthcare insurance market, they have to pay a ton of money to get their employees covered. So for a business, you just say, okay, all your employees are covered, and we got that covered. You don't have to worry about that now.
Yeah, to me
They're all covered.
To me, it's like a no-brainer.
No-brainer.
What about the big ones like Hewlett-Packard?
Yeah, the same thing with them.
Yeah, I mean.
I told these guys, I said, listen, you know, we have coverage for everything, 100%, single payer, everything's covered. Guess what? We don't need the workers' comp system anymore, right?
Right.
Think about it.
Right.
Yep.
The workers' comp system is like when you have an injury on your job, and then you have to have a bunch of lawyers and everybody gets together and they have to figure out whether or not you're going to get some money to pay for your health care and to take care of your injury on the job and all this kind of rigmarole. Well, if we had 100% single payer, you don't have to worry about the injury on the job because you automatically get your injury covered.
So many things fall in line.
You don't have to worry about your back getting thrown out or whatever if you did some road work or one of the guys got hurt on the job at the county and public works. You know, those are the guys I know about. They hurt their backs a lot, right? You know, the hard work they have, the physical labor. So I think it makes a lot of sense. It cuts out all that lawyer stuff. It cuts out all that, you know, the utilization management people. The time it takes you to get to a doctor in workers' comp, it takes months. You know, you ever gone through? How many people have gone through that at all? Okay, you know what I'm talking about? You have an argument about whether or not you should have this kind of coverage or that kind of, you know, it's like, it's crazy.
I love the time
It's
they
almost
try and
like
get out of it
micromanaging
too. Like,
your
you know,
health,
like,
too.
oh, I mean, you know, does it really workman's comp? Can't you use your own insurance for this? Like, it's.
Yeah. And then I'm big on the mental health thing because I'm the chairman of the mental health committee in the Senate, okay? And substance abuse. I think we ought to have free substance abuse, free mental health for everybody. And quite frankly, if we had that kind of thing, families would be a lot better. We can have programs in the schools, programs for seniors, you know, like all that kind of stuff could be done. You know, there's a lot of good stuff we can do.
Yeah, treatment instead of jail.
Get people out of jail, that's right. I have 2 bills on prison, getting mentally ill out of prison. There's SB562 and SB543. They're 2 bills I've authored on diverting people out of prison into mental health programs. Too many people get thrown into jail for health care reasons. Excuse me. Yeah.
I can hear you've already thought this through an awful lot. You're finding jobs for all these people that are in the insurance company that want to just answer the phone and say, no, you can't do this, no, you can't do that.
Right. Yeah. You tell me how you experience it, right?
I've been tested to death. See all this? I've been tested to death for this, you know, and now it's kind of too late. It's much more expensive surgery, but you know, it is what it is, and they just wanted to test it. They didn't want to
What
bother.
do you think of that? Did you feel happy about it?
Of course not.
Yeah.
Yeah, it's not very pretty, but you know.
Well, it's not right. It's wrong.
Not right. No, it's not.
Kind of
It's
immoral,
not a decent
you know,
health
when you
care
think about
system.
it, you know, it's a morality thing.
Yeah, well, that's what I can't understand, how they can look people in the face and say, you can't have this treatment.
Yeah, got a cough.
Yep. Yeah, it's wrong.
Okay.
Senator Beall?
Thank you so much.
Yeah, thank you so much for
Does
hosting us
anybody else
today.
have a question? Okay.
Yeah, for those legislatures who are Democrats who look like they're not going to vote for the bill.
Yeah.
You'll be talking to them and.
Well, I kind of talk to them like from my experience, you know.
Mm-hmm.
You know, I chaired the County of Santa Clara Health and Hospital Committee for 10 years when I was a county supervisor. Okay. So I've seen everything.
You know.
And I tell them, I said, okay, here's what it costs to go visit a clinic, $100. You have a clinic, $100. Here's what it costs to go to the emergency room, $15,000.
Right, yeah.
So you can have 150 visits at the clinic for the same as it costs to go to the emergency room in Santa Clara County and spend the night there. Like if you get injured or you have a heart attack or whatever you have. Okay, if you go to the emergency psychiatric facility and you go in a 72-hour hold, $30,000. If you go to the state mental health hospital, $300,000. I can keep going. If you go to prison, $72,000 a year.
And a lot of people in prison.
I can go on and on. I mean, let's talk about all this wasted money. This is ridiculous.
Yeah.
Good.
This is your tax dollars. Do you like your money spent on that stuff? Hell no.
Good. Thank you.
You know, we can't have that happen. That's wrong. I want the money spent on more $100 visits. Yes, if somebody gets hurt, if there's an injury, if they get an automobile crash or something like that, I want them taken care of, you know, 100%. But if we have a system that doesn't wait to have this big crisis or emergency, and you know, when we had the emergency room, I'll tell you this, when I was county supervisor and chair of the hospital committee, 1/3 of the people that went to the emergency room were mental health problems.
Oh, wow.
And then quite a few of them were undocumented people.
Yeah.
So I think having an opportunity for undocumented to purchase insurance at an affordable rate, even if they're not a U.S. citizen, is necessary in our society here in California.
Well, definitely.
I mean,
It's only human and
It's
humane.
human.
Yeah.
It's,
yeah.
it's only right.
And they should be allowed to, you know, I'm not asking for a government subsidy. They could just buy, if we did it the way I'm talking about with the single payer, they can buy pretty inexpensive, you know. And I don't want them clogging up our emergency room.
Good.
You know?
Well, thank you again.
Thank you so much.
We appreciate it.
You ever talk to nurses or any of you guys nurses or anything like that?
Oh, no.
Kind
Not
of
the
medical
nurse
field.
Yeah.
Well, I've
There are
never met
nurses
a
in our
nurse
group, yeah.
that is against single payer.
No,
That's right.
they are.
I haven't yet met one. Doctors seem to be a little mixed about it, but I've never met a nurse that's against a single payer. You know, never. I've never, in my total career of working with healthcare for many, many decades, actually, met a nurse that's against a single payer system.
What do you think some of your Democratic colleagues, why they would vote against this bill?
The insurance companies spend more money lobbying than any single industry in California.
Yeah.
They spend millions and millions of dollars.
Oh, that's a different.
And when they have something really big, they hire every lobbyist in town. You know. Excuse me, it's like hay fever here.
Oh, gosh, yeah.
I get the hay fever.
We use Flonase. Have you ever
Yeah, I
tried it?
should get some of that.
Yeah, it really works.
Well, thank you, everybody.
Thank you.
Thank you very
Good
much.
to see you.